Jersey health officials saying the highest rate of daily cases in more than 4 months. In fact, just yesterday, the state reported 1,301 new cases. That is the most in a single day since May the 29th.
Yeah, the hotspots are in Ocean and Monmouth counties. Tonight, Governor Phil Murphy joins us live via Skype to talk about the situation. Governor, thanks so much for being with us.
My honor to be with you.
All right, so I mean, let's get into it here. So I don't know if we're going to call it the second wave or what, but clearly there's a problem. I know you're begging folks to get tested, but what else are you doing?
Yeah, good to be with you. Listen, I'm not sure this is the second wave or a wave within the first wave, and frankly, in terms of our public health reaction, it doesn't matter a whole lot. You're absolutely right. We've had much higher numbers of late. We're not alone, by the way. You're seeing that in a lot of the country. And we've had particular hotspots. Ocean County, as you rightfully point out, Monmouth, higher education. But it would be a mistake to just limit it to that. We're seeing some amount of community spread up and down the state. We're surging testing. We're surging contact tracing to the hotspots. I just literally walked out of a meeting, almost didn't make you on time, talking about distribution of a new test that we're going to be distributing next week, Binax, which is a 15-minute turnaround with a very high percentage of reliability. And we're looking at general steps we could take, but frankly, much more so at surgical steps that we may need to take. We need everybody to keep doing the basics. We don't have a vaccine, we don't have therapeutics, so social distancing, face covering, wash your hands with soap and water, and take yourself off the field if you don't feel well or you've been exposed. And as you rightfully point out, Corey, to get tested, but probably not immediately. If you think you've been in touch with someone who's positive, you got to wait a few days to allow this to incubate and then get tested. And that's that's the hand we've been dealt right now. We just got to play that hand.
And I think that's really important to emphasize over and over if you think you've been in contact to wait a few days for that time period. So, Governor, let me ask you something. What happens if the cases don't slow down? Could we actually be looking at another complete shutdown? And I actually hate hearing those words come out of my mouth, but is that a possibility?
I guess it's a possibility, but it is not, Tamsin, one that I personally, as I sit here today, think has a high likelihood, and it certainly is one that I would prefer strongly not to do. Could we take statewide steps that are more of a blunt instrument, like looking, and we constantly look at gathering capacity limits that we have? You know, are those the right numbers, both indoors and outdoors? We've got another reality here, right? So the weather's getting colder. So we had a summer where we could do a lot of stuff outside, and we had good weather for the most part. That's going to begin to work against us. I will say this: we don't have a lot of evidence of in-school transmission right now. I'm knocking on wood, or transmission from indoor dining or indoor gyms, indoor amusements, at least so far. And God willing, if it stays that way, that's something over time we can responsibly begin to continue to open.
Mm-hmm. You mentioned schools. I'm curious, do you have, does the state have numbers specifically of how many students in the schools have gotten COVID? How many teachers in the schools have gotten COVID? What can you tell us there?
Yeah, so we post an updated dashboard once a week. It was yesterday that we did that. And we have, so far in the state, we have 16 outbreaks, quote unquote, of in-school transmission, covering a total of 58 individuals. That could be students, teachers, or staff, and I don't have a breakdown of that. Now, those are 16 different buildings. The good news is we have over 3,000 school buildings. So listen, every case is important. We sweat every case, but in terms of expectations after 5 weeks in school, that is well within any reasonable amount of expectations, and please God, I hope it stays that way.
Yes, us too. Well, Governor, let me ask you one more thing before we let you go. You had a big event that has gotten a lot of attention in Bedminster. You've called for people who attended the president's last fundraiser to go get tested. Are people listening, and are they helping with contact tracing out there?
I'd say if we were taking a class, we'd get an incomplete grade in terms of how folks have done. The state, and I'm not patting myself on the back, our Department of Health, the Somerset County Department of Health, the local folks in Bedminster have done everything we could do. We got very little help from the feds, frankly. And in terms of the individuals, it's been a mixed bag. Our primary focus, as you can imagine, was on is on New Jersey residents, and that includes staff members at the club. And we're doing everything we can within the four walls of New Jersey. But we also did everything we can because it was a national event. You had people from all over the country at the event, and we did our best to fill the void that was left by our federal side. And again, the results, like a lot of contact tracing right now, the results are mixed, and that's a shame. People need to take the call, cooperate. They're better for it. We collectively are better for it.
Absolutely.
All right, Governor Murphy, thank you so much for the insights. Obviously, we stay in touch as we all try and get through whatever the heck that we're in right now. Thank you.
You betcha. Thanks for having me back.